autistic cases with a miasmatic view in homeopathy. I'm Dr. Alka Parvate, the moderator for today. To tell you a bit about Dr. Bhuvaneswari, she has graduated from the prestigious Government Homeopathic Medical College and Hospital Thirumangalam, Madurai. Driven by her commitment to excellence and armed with exceptional diagnostic skills, Dr. S. Bhuvaneswari established the Adiesha Holistic Homeopathic Clinic in 2015 in Chengalpattu, Tamil Nadu, near Chennai. Her focus is on providing personalized, effective, and natural healing solutions. What sets Dr. Bhuvaneswari apart is not only her success, but her dedication to nurturing the next generation of homeopathic doctors. With a wealth of practical knowledge, she mentors aspiring practitioners, sharing insights and expertise to shape the future of homeopathy. Her contributions extend beyond clinical walls. Her clinical case studies have been published in reputed journals like Homeopathy and Dare. She has showcased her depth of clinical experience and her success stories there. So, over to you, Dr. Bhuvaneswari. We are eager to learn from you. Please begin.
Good evening to every doctors. First of all, I want to say sorry because being a homeopath, I didn't taken responsibility of myself to attend each and every webinar due to my personal commitments. And thank you for the doctors who very eager to attend the session. From bottom of my heart, I want to thank each and every doctors who came to learn something new, because learning each other is a wise wisdom which I feel. So this is my another way of perspective in autism, especially the rational approach. I want to showcase the main theme here is that how in autism, almost especially within 5 years or within 10 years of age, the autism kids always shows the common symptoms of autism, which is known by each and every person, especially the autistic mothers too. So, with common symptoms regarding the autism, rather than considering the personality of the kid, especially by the peculiarity, seeing the peculiarity of the kid, especially through inheriting characters from mother, from father, or from their grandparents, including their familial history or past history. So that's why I have chosen this topic of rational approach. Another reason for choosing this topic regarding autism for rational approach is that selection of medicine and selection of potency, because in a deep-seated pathology, especially when there is a developmental disorders, as we all know, it is through syphilitic background. The predominant miasm always will be syphilitic background rather than psychotic background and soric background. So, whenever the predominance of syphilitic miasm is prevailing in a particular individual, irrespective of any disease, we should be very careful in selecting the remedy, especially the mineral kingdom, which is especially the first prescription, which should not be a mineral kingdom, because the predominant of syphilitic miasm spoils the case by mineral kingdom, though it can be a simlimum remedy. So we should be very cautious in selecting, especially the mineral kingdom in syphilitic predominance, though all the cases are very common with all the three miasmatic backgrounds, because the aggravation will be more in mineral kingdom rather in second prescription or in repeated follow-ups. Once the patient started responding to your first remedy, you can choose mineral kingdom if we believe that that will be the constitutional simlimum. So now I go to my case. Before that, I want to give you a layout of miasmatic background with how the autism spectrum disorder is handled by each and every homeopath, especially based on constitutional symbolism. What are the important thing we have to take care of while framing the totality of symptoms? So, here the genetic predisposition and the hereditary characters and the hereditary inheritance in any form, either through physical behavior or mental level or emotional level, which plays a key role in developmental disorders, which we should consider as the peculiarity of the particular kid. So, as a homeopath, we have to be very clear in particular thing, genetic predisposition and the familial inheritance, which plays a major role in disease manifestations. Such type of developmental disorders like autism, Asperger syndrome, Panda syndrome, Singed syndrome, ADHD all comes under the developmental disorders, which we have to be very careful in seeing the miasmatic background, the genetic inheritance, hereditary characters transferred from grandparents or parents, or some sort of peculiar characters in the particular child which get affected. Along with that, we have to consider the miasmatic background as well as the three planes to rule out the personality of the particular patient through emotional, intellectual, and physical level. Out of common survey done all over the world, especially regarding autism, 6% of autistic kids are boys rather than girls, with the prevalence age of around 5 to 11 years. Sorry, I thought I didn't share the screen. Sorry, I forgot with my flow, I forgot to share the screen. So, this rational approach of autism through miasmatic view helps to frame the totality of symptoms, which is the key guidance to select the symptom when we are doing the case taking. Along with that, we have to consider the stage of the miasm in that particular person, irrespective of any age or gender. These two things helps us to select the exact symptom and to choose the exact potency which is needed for the patient. So, the homeopathic view of autism with genetic and hereditary with the important role from life after birth. So, children almost having the inherited characters from their parents, they will exhibit these characters through physical level as well as the mental level. Homeopathy as a holistic science, we have to consider regarding the genetic predisposition of a patient, especially when treating a child who is having developmental disorders. So, the thorough understanding of the inherited traits along with the potential expression of playing the major role in disease manifestation. So, here the Hahnemann standpoint comes under the theory of chronic diseases, which is a gift or boon to the homeopathy, where he clearly explained as a crystal clear with syphilitic, psychotic, and a psoric background. The importance of the miasmatic prescribing is very important in children as well. So these three broad constitutional types indicates the susceptibilities and the illness stage where the kid is struggling. Along with miasmatic background, we have to give more importance to the understanding the case taking with the detailed study of three planes: emotional, intellectual, and physical. Along with dominant miasm as well as studying the case through three planes gives us a clear picture to select a symptom as well as to choose a right potency which initiates the cure rather than suppression. The importance of miasm in today's world, being a homeopath, we have that responsibility to give more importance to the miasmatic background, whatever could be the disease. These importance of miasms not only matches with autism or developmental disorders, it also matches with any type of diseases. So, this miasmatic prediction can be given in a short summary. I have layout, especially the behavioral patterns and vocabulary skills of the particular kid, which helps us to rule out actual miasm in that particular person. Of course, all the personalities will have all the three stages of miasms, but certainly one stage of the miasm will be predominant rather than the remaining two miasms. So, according to that, Hahnemann's view related with the developmental disorders, the children with expressive language deficit, especially the kids can't find the right words, always tells a story by filtering out the words, missing the important words, instead naming the specific objects. Instead of that, they are telling some sort of irrelevant things. Instead of, for example, instead of telling pen, either indicating the pointing the pen or telling something other than irrelevant, like stick or spoon or something irrelevantly telling other than exactly predicting the name of the object. Such an individual comes under syphilitic, sometimes psychotic trait. Even the simple words, especially the first stage of speaking words around 8 months or around 6 months, or some kids will have the delay around 10 months. If the particular kid is not developing the simple words like saying mama or dada, or can't able to be very lively and active in the particular environment, getting very late more than 1 year 2 year creates a mess, that will be the alarming sign of the parent as well as the doctor to rule out any developmental disorders can be seen in the particular patient. So instead of missing even the simple words as the vocabulary, the child points using its fingers or using gestures to indicate desires. More often, this comes under psychotic trait as the child's memory is very poor and also very distracted in concentrating whatever the mother or father or grandparents teaching among the family, which also affects that particular child with scholastic performance. The vocabulary in such children is severely limited, means it comes under most prominent with syphilitic, least prominent with psychotic. Their use of various grammatical structures also marked below the age and below the expected levels. Their milestones also get delayed. Sometimes, if it is delayed slightly, for example, instead of lying on abdomen around 4 months, the baby is lying on around the 6 months or 7 months is okay with psychotic trait. If it is completely delayed, even in my clinical disc, I am having a case of a child who started lying on abdomen around 9th month. Such a kid comes under syphilitic trait. Their later stages will be a messy life where they've started facing social communication missing. So, because of that, the child faces emotional problems involving poor self image, frustration, and depression. Such sort of emotional difficulties and emotional problems also comes under syphilis. There is a major thing we have to find out. Sorry. we have to be very much careful. Though the milestones are not delayed much level, even in some kids all the milestones will be very normal, especially till walking the milestones will be very normal, but the speech can be delayed even after 2 years or 3 years. Such the individuals, such the kids comes under most prominently psychosis rather than syphilis. Even in some kids, within 3 years or 5 years, they will be very normal with the minimum delay. Such kids comes under SORA or psychosis after 5 years of age, where the brain has completely developed. They started facing, especially when they started going school, because they have some sort of social communication abnormal behaviors, which identified as first thing as dyscalculia, which comes under difficulty in learning or concentrating or understanding any simple mathematics. The arithmetic calculation will be completely zero or completely poor. So such kids faces a major challenges comes under syphilitic trait. Some kids will be a prodigy child where the memory retention will be very huge. Such a prodigy child, memory retention only will be very huge on the intellectual level regarding the memory storing only will be good rather than analytical skills. For example, even I know in from my clinical test, one of the kid who is very much prodigy child, he has all the abilities to handle even among the society. The major thing is that the missing of eye contact and the walking of toes and some sort of irrelevant verbals produced by the particular kid, but the kid is very excellent intellect, having the prodigy skill of even from the younger age of learning till he is around 15 years of age. Till 15 years of age, such kid can able to learn everything, concentrate everything, even that kid is topper in his school. So the beauty of homeopathy lies in the simlimum as well as the personality analyzing his that boy skill major is gifted with memory retention. He can even able to tell all sort of date of purchase, some sort of objects or some sort of historic events or some sort of events happened in the society. He can able to tell even missing date, month, year. So such a gifted prodigy child also seen in autism. So the kid especially facing the difficulty of calculating maths have the disorganized behavior. They will be very violent, very destructive. They can't able to handle or can't able to aware where he is surviving. Especially the closed environment will be very secure. Other than that, he feels, especially in school or any outside environment like public gatherings, makes that particular child to feel very insecure, which makes the particular child to be very aggressive and very disorganized. Because calculation of maths, learning any arithmetic things needs the high degree of organization where the particular child will lack. So, coming to my topic here, the autism spectrum disorder, it comes under the impairment mainly in social and interpersonal skills, where the child misses the eye contact, social smile, attachment to the near and dear ones. They treat people sometimes as furniture, abnormal social play by organizing some sort of objects or organizing the puzzles. They always like the monotonous things, especially they collect the toys which they feel favor. For example, if your particular child likes only cars, means whenever he goes out, whenever he goes to mall, he purchases all type of cars. That particular child comes to home and organize the particular even 20 or 30 cars in the same direction, same plane, and as if as a row. Even a single alignment missing makes the particular child to be feel irritated and aggressive. So such sort of monotonous habit of aligning something in order, walking on toes, and the developmental delay in milestones, which always comes under the syphilitic trait. This obsessiveness of keeping monotonous and keeping aligned the particular objects which he likes more comes under predominant of psychosis rather than syphilis. Sometimes one or two milestones will be get delayed, like walking or speech, which comes under the psychotic predominance. So, among the autism spectrum disorders, the mental retardation, the as I already told through my clinical test, the boy who is having a high IQ and a prodigy child, such kids can be seen even in autism with the 25 percentage of the prevalence with the IQ level of more than 70%. Even the prodigy child can able to exhibit more than 90%. The large majority of the autism spectrum disorder kids comes under the prevalence of mental retardation with the low IQ level, where the low IQ level with mental retardation spectrum comes under the syphilitic trait. The IQ level with more gifted prodigy thing comes under the psychotic and more predominant of soric. So, what could be the challenges in autism? In spite of any impairment of the functions and the lack of social behavior, lack of eye contact, missing social interaction, living in its own world, these things out of that, as I already told in the first slide regarding the prodigy thing, where that particular autism theme comes under the idiot savant syndrome, where there will be only splinter functions with the rote memory of calculating ability and musical abilities. Most predominantly comes under soric, sometimes with syphilitic if the child in later stages develops more mental aggression and more problem in social communication and especially with the eye contact as well as with the communication skill among the strangers or among the public gatherings. The abnormal behavioral characteristics, especially in autism, where the child was ignored among the society, among the family, only by its characters like compulsive behavior, compulsive mannerisms, stereotype behaviors, as I already told, like stalking of some particular thing, head banging, body spinning, hand flicking, lining up objects, rocking, clapping, twirling. Every abnormal behavior comes under syphilitic trait. So here I am going to present my case with the boy of 14 years. He started coming to my clinic around the age of 14 years. He was studying in 9th standard, where he has the presenting complaints of periodical occurrence of itching in groin since 5 years, where his mother treated only with the external application by plant like aloe vera extract or something related indica extract and all she has used. He always faces the challenges of sleeping disorders, especially even in the late night. He will sit and he will just poke his mother as well as moan something irrelevantly, making sounds irrelevantly, which causes a huge mess up among the family. Can't able to sit in one place, unaware of the environment. Even he was studying in a government school where they can able to support him, though the particular management of the school knows everything regarding him, because they want to support this particular child as their family comes under very economically poor. This case I am treating, not even getting a single penny, because I want to save the life, which made me to give more importance to this particular child. This case is very much closely connected to my heart. The reason will be revealed in the end of the session. I will tell you why I have a close connection with this particular case. Can't even able to sit few minutes in the class. He can able to out of 9th standard, since he is in government school, as there is a compulsion of getting pass each and every year, they didn't give importance to the learning. He knows only to scribble, he knows some of the few words to write. Other than that, his paper in exams will be very clear, not even 3 to 4 lines. Other than that, he won't write anything, because he can't be able to concentrate, he can't be able to sit in one place, he can't even understand what they are teaching. So in that such situation, even sometimes he gone away from the home without informing in the evening time, as he goes in a stereotype to some other places like near the pond, near the garden, near the neighborhood friends place. So his parents able to take back to home. So this is the actual situation of the particular boy. Here, he presented with the physical generals of sleep, completely disturbed, hard to make him sleep. Thermal, he is very chilly. Even he prefers to wear full sleeve, even in summer times. He is very thirstless, since he is very unaware whether he can able to feel the thirst or not. Sweat under the arms, especially, which will be very smelly. His inner garments and the shirt armpit will be completely stained with brown color. His appetite will be very ravenous, very foodie, eat more, can't tolerate hunger, get aggressive whenever he is getting hunger. He craves all types of non-veges, especially with the meat. And since he is a foodie, he has no specific aversion. He even having the habit of passing bedwetting, though in the daytimes the urine is very normal. He learned starting telling that I want to pee around the age of 7 or 8 years. Till that, he started passing urination only in his pants. So, stool 2 times a day, almost a soft stool. His ailments start as autistic kid always have the more genetic predisposition characters and familial inherited characters. I gave more importance to the mother ailments, the emotional cause, what happened to the during pregnancy as well as breastfeeding period, especially to the mother, because this particular mother have a normal child. Her first son is very normal, very intellect. Her second son is like that, because the reason is that he got detached from her husband, as her husband is very suspicious and very alcoholic, always uses bad words, mentally abuse her. Out of that, her mother, I mean the grandmother of the particular child, get separated from the father and keeping her along with her. The grandparent, mother, and the two sons are supported in a single room as a home. This mother is always sad and depressed, not with get separated from her husband. She feels very insecure and worried about the fear of future, as she was fighting even for the 3 times of food as a regular meal. So, considering these mother's history as well as the child physical restlessness, he always tries to like cycle riding very fast, beats his friends in school, and unaware of the environment, understands only the comments of his brother, mother, and grandmom, as they were very close to him. Even he obeys more commands with his brother, because his brother always beats him, thinking that he can able to understand only by beating. He likes to colors, especially the coloring things. He always asks his mother to buy the coloring books where he has no sense of color matching, and he always tries to color beyond the margin. He finds very much difficulty in retention of writing but somewhat better with reading. He always likes traveling. That's why he always roams here and there. He goes away from home in the evening times, especially without informing to the family members, because he always connected with the nature. He loves nature. He has the fear of animals. Even the dogs or cats or cow comes far away from that, gets fear, very panic. Even he started screaming and crying and running inside the home. He has the tendency of aversion of bathing. He never minds about the personal hygiene. Very messy, clings to his mom. Though he obeys all the commands of the family members, he loves his mom well, more clinged to his mom. So this is the totality of the symptoms of the particular child. He had the past history of primary complex at the age of 4 years, which denotes the key thing here is that the prevalence of tuberculosis antibodies inside his body, which is my selection of Simlimum, and also he always faces the often episodes of wheezing, which is treated by giving home extracts or giving nebulization in the hospital. He had the family history of father alcoholic, mother working as a servant, history of recurrent cold and wheeze, even for his mother as well as his grandmother, having the history of bronchial asthma almost more than 30 to 40 years. So here I gathered the symptoms of totality with ailments, mom separation from the husband during pregnancy, fear of future, insecurity, chilly thermal, periodical occurrence of skin ailments, even in summer times, violent, aggressive, difficulty in writing and concentration in maths, desire for non-veg, especially meat. He likes always speed wherever through whatever he uses to go, cycle, bike. Even his mom is having one old bike where he loves to go in bike with speed, physically restless, can't able to color properly without color sense, without able to color it within the margin, clinging to the mom, bedwetting, frequent stool with a soft nature. So considering this, I gave a remedy. uh, Anyone want to guess it, what could be the remedy?
Yeah, could be Soraina.
No, doctor. Any other idea? Okay, doctor, I myself will tell. I used tuberculinum 30 CH so far out of 1.5 years almost, almost covering 2 years. Out of that, I have given tuberculinum 30 CH and tuberculinum 200 CH. Other than that, I didn't even prescribe till now tuberculinum 1M also. Only tuberculinum 30 CH 1 dose and tuberculinum 200 CH 1 dose. Along with that, I followed almost 1.5 years to 2 years only with the placebos. Here, he responded in such a way, his sleep regulated, his skin complaints permanently gone. He can able to understand the awareness of the environment, understand the sense of danger. Even the main happiest thing, why I told that this case is closely connected with my heart. The reason is that treating the person who is very hopeless, feeling that how to handle and how to manage this particular kid with low socio-economic status. Here I wantedly treated that particular child because this servant is my clinic servant. He passed in 10th standard in first attempt. All the subjects he got passed. With that, with my guidance, he got involved in joining the government college, which is in Gindi Polytechnic, where he is. The beauty thing is that only one day his mom went and show how to get to the train, how to get down from the train, and how to go to the college. With that help, he is having one button phone. With the use of button phone and with the use of co-passengers guidance, he is traveling alone daily in the train and learning and coming back safely. That's why this case is closely connected to my heart. So, considering these things, what can give us being a homeopath? The joy of drastic change in a boy, making him to survive in the world independently with the fittest, simlimum with the miasmatic approach, do wonders in homeopathy. Let us explore homeopathy together with experimenting the rational approach as well as selecting the constitutional simlimum, which is a major perspective in my in homeopathy, which is guided, which is gifted by our great master Honeyman. Thank you all, one and all, who is very patient to listen whatever I told here. And another thing I want to thank from my bottom of heart to the Dr. Rekha ma'am and Dr. Vaishali ma'am and Dr. Padmaja Rao ma'am. She, as she was the first person, initiated these people, first initiated me to start my career by taking webinars. So really, these people are like my role models and inspirers. Other than that, I can able to see many doctors. Unfortunately, I can't able to remember all the names. Otherwise, each and every person in this particular woman homeopathic group, all are religions, all are great in their perspective. Thank you, one and all. Hope we will grow together by learning together. Thank you.
Wonderful, wonderful. Dr. Bhuvaneswari, as
Yeah,
always, yeah. You are very vocal for homeopathy and that too classical, and I like that very much. And keep it up. That is your USP. Yeah, and
thank you. Thank you so much.
and especially at this age, that is 14 years, you are starting the treatment, and you are bringing out such a wonderful feat with homeopathy, of course, and everything else is correct. Okay, and the way you chose the remedy, everything very very wonderful, and the patience you have instead of muddling with the remedies and prescribing over prescribing, that is really I have to learn maybe. I'm a very restless person. Maybe I have to learn that also. That's very great, very wonderful thing. And one thing I want to make a point. If you have observed, all of you observed that the child had a primary complex in young age,
Yes,
and that is a
ma'am.
very important point for Dr. Bhuvaneshwari's simulation as well, I think.
Yes,
Uh,
ma'am. Yes, ma'am.
yes, and that indicates that nothing in a patient is comorbid. Everything is continuum, as Dr. Professor Vittal says. Continuum means every acute things will lead to chronic diseases, and that is the reason why he has improved very well, I guess, because of Dr. Bhuvaneshwari's perfect symbolism.
Thank
So,
you so much, ma'am.
yeah, so this point I want to just highlight. So, nothing is uh, like separate things, comorbid, this and that. Especially in autism cases or any homeopathy cases, it is continuum. Yeah, one thing leads to another, and we have to be very careful about all the things. Very nice, doctor. Any questions? We'll see. Any doctor? Any questions? Please shoot.
Good evening, ma'am.
Yeah, once again, doctor, I want to lift this screen.
Yes.
One second. Yeah,
Yes, doctor. Someone was
yeah,
about
doctor.
to ask a question.
Yeah, good evening, doctor.
I think Rachita.
Yeah, yeah, ma'am.
Yeah, doctor.
Ma'am, how is suffering from primary complex? How can you confirm it?
Actually, doctor, your voice is breaking a lot. Can you text back?
Ma'am, is it audible now?
Yeah, yeah, yeah.
Ma'am, how do you confirm it, that we suffering from a primary complex? On what basis you have confirmed it?
Actually, they are maintaining the records now. Because primary complex is a major
Okay.
thing, which is a early symptom of tuberculosis in the younger age. Even I had the history of primary complex in around 2 years of age. So with that, only with the
Okay.
investigations, and also they having the familial history of
Actually, when her
tuberculum myasm, because his mother is also having wheezing problem, bronchial asthma. His grandmother also having that same bronchial asthma problem. So it comes under tuberculum myasm very easily.
is it primary complex active when it's in?
Doctor?
Is it in an active state? Is the
Actually,
primary
that
complex
boy
in
faced in a young age only, around 4 years of age. He started getting treatment around with me around 14 years. So might be suppressed with antibiotics. That is the major reason for that particular boy also get often periodical wheezing in the winters, skin complaints in the summers. The periodical annual return of every symptom.
Yes, I think hopefully it has. She has answered your question, Dr. Rachita. Your voice is breaking actually.
Yes, ma'am.
Do no sorts can be prescribed in active state of disease?
Final sentence I can't able to understand, doctor. Your voice is breaking.
I think she is asking
Okay.
whether no shots can be given during active stage of a disease.
Yeah, definitely.
Yes, ma'am.
Especially with the mental disorders or related with, if it is, for example, if the particular boy is not having any mental symptoms, I mean mental developmental disorders, that boy is having only wheezing related symptom means definitely the first prescription should not be a no. Because with the lung active stage, if we prescribe nosodes, of course if it is simlimum it helps to get better with the symptoms, but the thing is that the challenging thing using nosodes in active stage of lungs gets more aggravation, rather than the better thing is that the choice of nosodes in between the treatment is okay. If the stage of the disease is very active, especially if the particular disease is acute exacerbation of the chronic syphilitic stage or latent syphilis, especially in the old age people, definitely we should not prescribe nosodes. It's not safer to prescribe nosodes. Thank you, doctor.
child with a higher IQ or a prodigy child or such a type of children are generally in the psychotic or soric base. This
Yeah,
is what you told, right?
yeah.
Okay. While the autistic child with mental retardation comes in the syphilitic side,
The
right?
main thing is that they can't able to express the normal characters of the particular individual, whatever could be the age. They are missing that particular thing, especially the abnormal behaviors or emotional disturbances, as well as especially the behavioral disturbances in the major situations like outside the environment or among the public gatherings, unaware of the environment, unaware to obey the comments other than the person in the family. So these things comes under syphilitic trait because we always know about the syphilis, whatever could be the expression in physical plane as well as emotional plane or mental plane, intellectual plane, it comes under the destructiveness. As a common theme, Sora always in the functional level, psychotic always will be the proliferative level or accumulative level, whatever could be. The accumulation of any form. For example, physical level, if the accumulation of something like gallbladder stone, renal stone, or related with fibroid or ovarian cyst, or any sort of stone formation or any bulky uterus or uterus thickening always comes under the accumulation and proliferation of the cells predominant with the psychosis where it becomes into the destructive stage when it turns over from tumor to cancer, benign to malignancy, the destructive stage of any type of cells or any type of layers or any type of organs comes under the syphilitic phase. So the common theme of every miasm is soric with the functional level, psychotic with the accumulation level, and syphilitic with the destructive level.
So, madam, as you told, so if the child is 3 years or 4 years or 5 years, we are taking the history of parents. And if they are having such illness, as you told, any uterine fibroids or some psychotic miasm, we will take that the child is also having this miasmatic base, right?
Yeah, we can consider
Okay,
it.
madam. Okay, madam. Thank you very much.
Thank you, thank you. Yeah, thank you, Doctor. Thank you, doctors. Thank you, everyone.
Thank you, ma'am.